So Nature Reviews Neurology reached out to Professor Henry Brodaty and myself and asked us to do what's called a year in review piece. And so we looked at all of the existing literature about COVID-19 and dementia that had been published to date. And we concluded that the reason people with dementia are disproportionately impacted by COVID-19 is because they're more likely to get COVID-19 in the first place. If they get it, they're more likely to have severe medical consequences associated with it, and they're more likely to be in isolation and suffer from the effects of isolation for longer than other populations. So people living with dementia are more likely to contract COVID-19 first because they're more likely to have risk factors associated with getting the disease. So being older in age, having maybe heart problems, diabetes, things like that. It's also harder for them to follow social distancing measures. Essentially what COVID-19 does is it causes an inflammatory response in the body and the brain. And people with dementia are likely to have a certain type of allele that also is responsible for causing inflammation. And so when the two kind of combine, they have a lot of inflammation, and a response to inflammation in the body is called cytokine release. And if there's too much release, it can actually cause your organs to shut down. People living with dementia are more likely to have pre-existing neuropsych symptoms like depression and anxiety. So when they're going into isolation and you're taking away social supports, disrupting day-to-day activities, then we're just seeing a heightening of these pre-existing symptoms.